morning, we'll talk about COPD, chronic obstructive pulmonary disease. First, we'll talk about definition, classification, and epidemiology, and risk factor and causes. Then talk about treatment and as influence the physiotherapy in the COPD. So what is the COPD?
We're field of COPD, chronic obstructive pulmonary. Chronic obstructive pulmonary is defined as a disease of the airways that can be preventive and treatable. COPD is characterized by a slowly progressive and irreversible obstruction airflow. This disease is divided B disease such as shorty bronchitis and emphysema. Epidemiology. Well, I say for important points such as fears. It affects 4% of the world population. In Colombia, 9% of the those over 40 years. There's rest for in the world as case of that and for increasingly has worth a cause of the disability.
Okay, the risk factors. The principal risk factor is smoking. Another risk factor is having respiratory disease in childhood. Also in influence, gender and age of the patient. And genetic factors are less common. The causes, the principal causes is the cigarette. The smoker is exposed 95% to have COPD. No other common causes is having cooked with firewood for a long time and being to toxic fumes unprotected. The symptoms depend if the COPD is chronic bronchitis or emphysema.
The chronic bronchitis is an inflammation of the bronchial duct. It's a kid kind of COPD. It is a long term of keeps canon keeps coming back or it of is irreversible. The chronic bronchitis is very obstruction of milk or serious.
Okay, let's me introduce, and my name is Lina Maria, and I am going to about the emphysema. That is an image of the lung emphysema. The emphysema is an inflammation the alveoli, the walls, the alveoli. You may have a cough, and you will feel shortness of breath. Many people have been interested an investigation of COPD. Recently have found that emphysema that cause the loss of the ability to transfer oxygen to the blood. If you are to prevent the emphysema, is to stop smoking and avoid the exposure irritants. The physical exams, the first exam, spirometry, you can look the disgrace to floor volume, the curve, and then a radiography or electrocardiogram.
The climate is very important because it's different of obstruction mild or serious. We have consult doctor first because it is important diagnostic. The very important is we or you must keep smoking or snuff. You must avoid keeps or coming back. You must feel shocked because can be more dangerous is if pneumonia or occurs. Medicine and antibiotics is very important for inflammation or symptoms. The physiotherapy is very important because it helps our patients or passionate people, patients are people and breathe properly. With COPD is severe smooth or surgery.
In the pathophysiology is ways is a different acute and V electrocardiogram, which is at the same time that air cannot be transported normally, that is will in turn to affect the circulation. In the pathology of COPD, we see certain criteria to look as disease occurs. The physical therapy is very important in the disease to create a new lifestyle so that the person may again have their respiratory capacity. In terrain, we see 4 stages where a person will show symptoms so that they can be classified into each stage.
Thank you for your attention. If anyone has any question, I will be pleased to answer them.